This vaccine helps prevent respiratory syncytial virus, RSV, infection, which can cause serious illness in older adults with certain health problems and infants. It can also be given during the third trimester of pregnancy to help prevent RSV in the newborn baby. The vaccine works by causing the body to produce its own protection against the virus. It's important to note that vaccines may not fully protect everyone who receives them. Remember to consult with your healthcare provider for the best time to take this vaccine and the appropriate daily dosage. Before receiving the vaccine, make sure to read all the information available from your healthcare professional. If you have any questions, don't hesitate to ask them. The vaccine is administered through an injection into a muscle in the upper arm by a healthcare professional. After receiving the Abrysvo 120 mcg/0.5 ml intramuscular solution respiratory syncytial virus, RSV, vaccine, you may experience soreness, redness, swelling, or bruising at the injection site. You might also have muscle aches, joint pain, headache, or feel tired. If any of these effects persist or worsen, it's important to contact your healthcare professional. In rare cases, some individuals may experience symptoms like fainting, dizziness, vision changes, or ringing in the ears shortly after receiving the vaccine. If you experience any of these symptoms, it's crucial to inform your healthcare professional right away. Sitting or lying down may help alleviate these symptoms, as they typically do not last long. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's essential to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned, be sure to contact your healthcare professional for advice. If you have concerns about side effects, it's important to contact your doctor for medical advice. In the US, you can report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the Abrysvo 120 mcg/0.5 ml intramuscular solution respiratory syncytial virus, RSV, vaccine, make sure to tell your healthcare provider if you are allergic to it or any other vaccines, or if you have any allergies. This vaccine may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Also, inform your healthcare provider about your medical history, especially if you currently have a fever or illness, or if you have immune system disorders such as HIV infection, certain cancers like leukemia or lymphoma, or if you have undergone radiation or cancer treatment. If you are pregnant, your healthcare provider may recommend RSV vaccination, but it's important to discuss the risks and benefits before making a decision. It's not known if this vaccine passes into breast milk, so it's important to consult your healthcare provider before breastfeeding. When taking Abrysvo 120 mcg/0.5 ml intramuscular solution respiratory syncytial virus, RSV, vaccine, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk of experiencing serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your healthcare professional. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Abrysvo for its intended purpose. Abrysvo is used to help prevent serious lung disease caused by a virus called Respiratory Syncytial virus, RSV, in infants and young children at high risk for RSV disease. This vaccine is given as an injection into a muscle by a healthcare professional. It is usually given once a month during RSV season. The best time to take this vaccine is before RSV season starts, to provide the most protection for your child. Talk to your healthcare provider about the best timing for your child's vaccinations. Remember to schedule and attend all your medical and lab appointments. It's important to keep up with your healthcare provider to ensure the best possible outcome for your treatment. By staying on top of appointments, you can monitor the effectiveness of the vaccine and any potential side effects. This will also allow your healthcare provider to make any necessary adjustments to your treatment plan. So, make sure to prioritize your medical and lab appointments. Abrysvo is used to help prevent serious lung disease caused by a virus called Respiratory Syncytial virus, RSV, in infants and young children at high risk for RSV disease. This vaccine is given as an injection into a muscle by a healthcare professional. It is usually given once a month during RSV season. The best time to take this vaccine is before RSV season starts, to provide the most protection for your child. Talk to your healthcare provider about the best timing for your child's vaccinations. It's important to store Abrysvo 120 mcg/0.5 ml intramuscular solution respiratory syncytial virus, RSV, vaccine in the refrigerator, but make sure not to freeze it and protect it from light. Keep all medications away from children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. Remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.